So the NHS app was recently publicised and is due to go live across the country over the coming months. And that's a really interesting thing for us. So what we've been lacking to date is a sort of a centre of or somewhere to gravitate to have a sort of way into the NHS in a digital way. So what we've seen is numerous portals developing and different apps, but no sort of joined up approach to that. And the app provides what I think is a sort of digital gateway into the NHS. So a patient looking to access a health or care service, that should be their first point of call. It's an evolving project, and there's much more to come. But what it can do now is draw in the ability for which patients have been able to do through their own individual portals with their own practices for some time, the ability to book appointments, order prescriptions, check the results, look at their records, with added functionality like setting preferences for things and information sharing and those kind of things. So it really becomes a sort of a go-to digital space for patients. What's more important is tying our online consulting into that, and making that the way, making that link up to the NHS app. So we were going to be doing some work over the next year in linking the NHS app with our online consulting platform and general practice. And more than that, we're looking at how do we create a digital service in Devon that can deal with a lot of these issues around capacity and demand for our different GP practices across the area. So if we take, for example, the western locality in Devon, there are about 40 GP practices across that area, and within that there's a deficit of about 24 whole-time equivalent GPs. And that's a significant number. That's about 17% of the clinical workforce. And that's a problem. So recruitment is one way, but with recruitment you also get lost, people retiring and leaving the area. And it's not just a problem in Plymouth, that's just the tip of the iceberg. The problem is sort of well understood across the whole of the health service, and we're just seeing it's happening in some places earlier than others. So this is really sort of my sort of key area of interest at the moment, is how do I create a digital service that can essentially crowdsource the workforce into areas of need. So I can't physically pick a GP up and put them somewhere else in another setting, because we know that hasn't worked in the past. But can I have a GP working in one area, doing and helping out a GP in another area using some of the remote technology? So that's something we're exploring now and seeing how that works as a system and how that works within our primary care networks as they evolve and develop. But that's very much exploratory work now. The NHS app gives us a focus to do that, because it'll also include how we book into urgent care, etc., etc.